Hi, my name is Kennedy. We're going to be talking about Alzheimer's disease. Alzheimer's disease is characterized by progressive cognitive decline affecting memory, thinking, and behavior. Over 50 million people worldwide live with dementia and Alzheimer's. Alzheimer's is responsible for 60 to 70% of cases. As of 2023, approximately 6.7 million Americans aged 65 and older have Alzheimer's, and as time goes on, it's projected to triple. Women are disproportionately affected. Nearly two-thirds of Alzheimer patients in the U.S. are female, and of those females, most of them are African American. How Alzheimer presents in the early stage, it is characterized by mild memory lapses. In the moderate stage, the memory worsens and is accompanied by confusion and mood swings. The advanced stage, the individual loses the ability to communicate, recognize loved ones, and perform bodily functions. Uh, the it also the short-term memory loss is profound, while long-term memories may remain intact until later stages. They may forget difficult words, which is called aphasia. Patients also struggle with communication. Uh, they struggle with planning, reasoning, and problem solving. The history of Alzheimer's is started with Alois Alzheimer in 1906. This disease was first described by Dr. Alois Alzheimer, a German psychiatrist and neurologist, after observing brain tissue changes in a patient named Auguste Dieter. Alzheimer's work established the role of amyloid plaques and neurofibrillary tangles as hallmarks of the disease. Since the 1970s, advances in the neuroimaging and genetic studies have deepened our understanding of Alzheimer's disease, linking it to specific genetic mutations. The physiology of Alzheimer's disease, it starts with the amyloid plaques, abnormal clumps of beta amyloid protein accumulate between neurons, disrupting cell function. Neurofibrillary tangles, tau proteins inside neurons become twisted and disordered, leading to cell death and synaptic loss, the breakdown of synaptic connections, impairs communication between neurons, contributing to cognitive decline. The hippocampus is also affected during Alzheimer's disease, as well as the cerebral cortex and limbic system. For Alzheimer's to be diagnosed, the early stages of it is critical for better disease management. Some common tools include neuroimaging, cognitive tests, and biomarkers. Some treatments for Alzheimer's is uh, pharm- pharmacological interventions. These drugs are aimed to boost levels of certain levels in the brain, improving to improve communication between neurons. Some non-pharmacological approaches is cognitive stimulation therapy and lifestyle modifications. Living with Alzheimer's disease, from the patient's perspective, progressive memory loss can make routine activities like remembering appointments and recognizing faces impossible without assistance. Confusion and agitation often lead to frustration, isolation, and mood swings. The emotional and mental toll it takes on the patients often experience depression and anxiety as they lose independence. The role of family members and caregivers. Caregivers often experience physical and emotional exhaustion due to the constant care required, particularly as the disease advances. Some coping strategies that they may take are support groups and counseling. The emotional impact of Alzheimer's on families. Alzheimer's disease presents complex challenges for both patients and their families. While current treatments offer some relief, there is an ongoing need for better therapeutic strategies. The importance of early detection, continued research, and comprehensive support systems cannot be overstated in improving the quality of life for those affected. Together, as society continues to understand Alzheimer's disease, efforts to improve care, treatment, and ultimately find a cure must remain a priority. The emotional impact on Alzheimer's on fam- the emotional impact of Alzheimer's on families, the grieving process, watching someone you love gradually lose their memories and ability to remember you. The family can often feel as though they're the mourning the person they once knew. The role shifts from them being family members to being caregivers, and then having to make decisions, difficult decisions on whether to do long term care within their home and the finances that come along with it.